Now, when it comes to the topic of ptosis repair in the context of an Asian eyelid, you really need to work hard to find an expert in these areas. There are more surgeons now than 10 or 20 years ago across the US or even across the world who are pretty good at Asian eyelid surgery. They do it pretty regularly. But if you are combining that with ptosis repair and you expect your surgeon to repair the position of your eyelid, have your eyes look more symmetric, and to have a crease that looks the way you want it to be, or at least very close, you need to go to someone who does this almost every week. And there are not very many surgeons in North America that do this stuff every week, or let alone every day. It's even true that in other countries, Taiwan, China, Korea, a lot of surgeons don't perform ptosis with cosmetic Asian eyelid surgery at the same time. It's actually more time consuming, it's more difficult, and the revision rate is higher. And many surgeons who are performing cosmetic elective procedures aren't really interested in doing both at the same time. So wherever you are on this planet and you are considering ptosis repair plus modifying the way your crease looks in the context of an Asian eyelid surgery, you've got to pick the person who's got all the evidence to show that they do this regularly. Now, the way that you can perform a ptosis correction varies from one person to the next. If you have what's known as congenital ptosis, you have a badly droopy eyelid that just simply doesn't move up no matter what you do, you might actually be in for something that's called a frontalis sling or sling procedure, where you're attaching the internal anatomy of the eyelid to the brow and the musculature of the forehead so that you can actually open your eyelid better just by moving your forehead. Now, if you have bad congenital or significant congenital ptosis, getting your crease to match up on the two sides, especially if you have one side that works completely normally, and getting them to be even, is essentially impossible to accomplish, or at least 100% even. And even if you have creases that are 100% even looking forward after you've had your congenital ptosis repaired, you will notice that when looking up and looking down, they may not be even, and oftentimes they aren't. Particularly when looking down, you'll have on the side of ptosis where it gets repaired and you're looking down and you have what's known as lagophthalmos, or one version of it, and the lid doesn't move all the way down the way the normal side does. So if you have severe ptosis and it's been there since your youth, you may not be able to accomplish every aspect of symmetry, but you usually can get some good improvement of the way it looks and the symmetry. Now, there are people who have had ptosis since birth and it's congenital, but they have essentially normal movement of their levator tendon, or pretty good, where it matches the other side fairly well. Meaning, so when your surgeons are measuring what they call levator excursion or levator movement, they're looking to see how much the lid moves from a point just above the pupil that they're measuring with the caliper to see how much the ptotic eye or the droopy eye actually moves. And if it's got good movement, say 5-7 millimeters, sometimes a little less, you can still get a really nice repair out of that. Now, that is a congenital ptosis because you've had it since birth, but it's not so severe that you can't get good symmetry. Now, again, you won't have perfect symmetry no matter what you do, and you won't have perfect symmetry for sure when you're looking up and you're looking down. So just always remember that. Now, for those of you who have just had some mild ptosis from birth, where you always notice that one eyelid's a little droopier than the other, or maybe you developed it later on in life, those are more manageable. And all of these more manageable forms of ptosis, whether it be just kind of a moderate congenital ptosis or something that came on later in life, you can do that with an incision through the skin on the outside. You go in, you find the levator tendon, you advance it forward, maybe you shorten it, maybe you attach it to something known as the tarsus in order to just raise the position of the eyelid. You can also perform a procedure known as a Muellerectomy or a Putterman procedure, where you actually will flip the eyelid over, and we'll show a brief video a bit later to demonstrate what that is. And you're clamping, essentially just cutting away 2 layers roughly of the inner aspect of the eyelid, which is the conjunctiva and the Mueller's muscle. Now, that procedure has an incision that is on the inside of your eyelid, and there are dissolvable sutures on the inside of your eyelid. So typically there's not really anything on the outside that you have to look at if you're just repairing the ptosis. So that's one way of going about that. But usually, again, if you're using a Putterman procedure, the patient also wants to alter the way their crease looks. So sometimes you still have an incision on the outside just for the sake of manipulating the crease, even if the ptosis repair was performed with that Putterman procedure that I just described to you. Now, the healing process for a ptosis surgery actually a lot of times is comparable to age-related change surgery, or even an asymmetry case. That typically has to do with, again, your tissue characteristics, quality, and like I said, how private you are. If you're very private about what you do, then your healing time is just longer. And if you're not very private about what you do, then your healing time, in some sense, functionally, is just a few days. You can go to work or go to school or do some other things, oftentimes after you've had eyelid surgery, if you give yourself 3 or 4 or 5 days. But again, if you're private about what you do, you're going to have to wait.